Good day everyone. We are now going to learn about presbyopia. Presbyopia or aging eyes is a naturally occurring visual condition that generally becomes apparent in middle age. The definition of presbyopia comes from the Greek word which means old eye. Since it is related to age, it is a correctable and inevitable process. Presbyopia is not an error of refraction but a condition of physiological insufficiency of the accommodation. It leads to progressive fall in near vision and can have multiple effects on the quality of vision and the quality of life. The condition is independent of factors like excessive use of the eye or occupational strain. Normally, the lens in the eye accommodates or adjusts itself to facilitate the light rays to focus on the retina. But due to age, particularly when a person is nearing the age of 40, the lens loses its elasticity, resulting in defective accommodation, thereby difficulty in reading and doing near work. Such an error can be corrected by reading glasses. These glasses are actually supplementary lenses which compensate for the loss in accommodation and help the light rays to focus sharply on the retina, thereby increasing the acuity of the vision. We will now try to understand as to why presbyopia occurs. Before that, let us familiarize with few terms like accommodation, far point of the eye, near point of the eye, range of accommodation, and amplitude of accommodation. What is accommodation? It is the mechanism by which the eye changes refractive power by altering the shape of the lens in order to focus objects at variable distances. Far point of the eye is the position of an object when its image clearly falls on the retina with no accommodation. Near point of the eye is the nearest point that can be clearly seen with maximum accommodation. Range of accommodation is the distance between the far point and the near point. Amplitude of accommodation is the dioptric power difference between the eye at rest and fully accommodated eye. In emetropic eye, the far point is at infinity and the near point varies with age. The near point being about 7 cm at 10 years of age, 25 cm at 40 years and 33 cm at 45 years. We generally read from about 25 centimeters. After 40 years, the near point recedes beyond normal reading or working range. Failing near vision due to age-related decrease in amplitude of accommodation is called presbyopia. So how does the eye accommodate to objects that are near? First, as the object approaches, both the eyes track it in a process called convergence. Convergence of the eye keeps the image of the object of interest centered on the fovea, which is the part of the retina with highest sensitivity. If the eyes do not converge appropriately, double vision occurs. Secondly, the pupil must constrict to restrict the diverging rays from the near objects, since diverging rays cannot be bent enough by the periphery of the lens to make them fall on the fovea. If the pupils were to be dilated, the images would appear blurred. Finally, the shape of the lens must be changed, thereby increasing the refractive index so that the light rays passing through it can be converged on the fovea. In distant vision, the lens is pulled at the equator by the suspensory ligament so that it is relatively thin. When the muscles of the ciliary body contract, the tension on the suspensory ligaments decreases and allows the lens to assume a rounder shape. This in turn increases the capacity of lens to bend the light, and as a result, the image is focused on the fovea. All combined, the convergence, pupillary constriction, the rounding of the lens keeps the image of the object focused on the fovea as it approaches the eye. When discussing the mechanism of accommodation, we saw that the increased refractivity of the eye was probably brought about by the change in the balance between the elasticity of the lens matrix and that of its capsule, allowing it to assume a more globular shape. As age advances, several factors diminish the accommodative power. The lens becomes harder and less easily molded so that the elastic force of the capsule is no longer greater than the resistance of the lens substance. Moreover, the progressive increase in the size of the lens, together with similar changes in the ciliary body, slacken the zonules, thereby making the amplitude of accommodation less. This loss of accommodation is not considered abnormal, and it proceeds gradually throughout the life without any sudden alterations. Eventually, time comes when the near point has receded more than what the individual is accustomed to read or to work. He becomes seriously inconvenienced then, as he is unable to see clearly. Such a condition is called presbyopia. There is no hard and fast rule as to when this process commences, but usually it is expected that the condition becomes noticeable between the age of 38 and 42. If they occur before this age cutoff, it is called premature presbyopia. The causes for premature presbyopia include uncorrected hypermetropia, premature sclerosis of the crystalline lens, chronic simple glaucoma, and general debility causing presenile weakness of the ciliary muscle.
Is losing its ability to focus on near objects. Much like adjusting the focus on a camera, in a healthy eye, the lens flexes and changes shape to properly focus on objects at different distances. But as your eyes age, the lenses in your eyes lose their flexibility. The result can be diminished up-close vision.
The actual process of the loss of flexibility happens over a period of time. Anyone above the age of 35 is at risk of developing this condition. In fact, it may not be an exaggeration to say that nobody escapes this condition. It is just that it may be more pronounced in some in comparison to the others. Most people experience some loss of focusing power for objects near to them as they age. So what are the problems faced by a presbyope? The first noticeable symptom would usually be the inability to read the small letters, say in a telephone directory or a newspaper, would be very difficult to read. Such fine print would seem less clear and have less contrast. The letters may be seen running together or indistinct. More light may be needed to increase the contrast, which will enable the person to read, especially the fine print. Eyes get easily tired and fatigued while reading a book or while indulging in morning fetish of looking at a computer screen. When the problem is noticed initially, people overcome the difficulty by keeping their reading material farther away from their eyes. Soon, the problem becomes acute, forcing them to take other corrective measures. And also, the defective accommodation necessitates bright ambient light while reading or doing any close-up work like threading. The difficulty in focusing on objects that are ill-lit or close by is more pronounced when there's a sudden shift from looking at an object that are far away. If left unnoticed or untreated, presbyopia can cause headache. As the brain tries to cope with blurred images continuously, the additional strain of trying to perceive a clearer image results in a discomfort in itself. The excess strain of the eye can make one want to keep the eye closed for a while or rub it to provide some relief. Presbyopia can be detected by a comprehensive optometric test. Correction for near vision is usually indicated after the age of 40 years. When the distance vision has been satisfactorily corrected, the visual acuity at working distance of the patient should be estimated using any of the near vision charts like the Jaeger's chart, Snellen's reading test types. In case near vision is defective, further testing should also include near point of accommodation, amplitude of accommodation, near point of convergence, and determination of near ad. So how do we correct presbyopia? Eyeglasses are the simplest and the safest means of correcting presbyopia. We provide the patient with convex lenses so that his accommodation is reinforced and his near point is brought within a useful working distance. I'll now give a rough estimate for the presbyopic ad for the various age groups. For people around 45 years of age, the ad is +1 to +1.25 diopters. Similarly, for 50 years, the ad is +1.5 to 1.75 diopters. For 55 years, the ad is +2 to +2.5 diopters. For 60 years, the ad is +2.5 to +3 diopters. We always prescribe the presbyopic ad after taking into consideration the working distance required by the particular patient. During correction of presbyopia, we ensure that there is at least 1/3 of the accommodation in reserve. With that in mind, how can we correct presbyopia based on working distance? For instance, in a patient who is in his late 40s, there is only 3 diopters of total amplitude of accommodation left. In order to leave a comfortable amount of accommodation in reserve, we can prescribe an ad of +2.5 for the working distance of 25 centimeters, +1.5 for a working distance of 33 centimeters, +1 for a working distance of 40 centimeter, and +0.5 for a working distance of 50 centimeter. So, our presbyopic patients can now see the distant objects without any correction and the near objects clearly with his reading glasses. So what about the intermediate distance? The intermediate ads, which is 1/2 of the near ad in general, is required to enable the patient see the intermediate distance clearly. Now what are the modes of prescribing presbyopic ad? It can be given as single vision glasses, bifocal glasses, or multifocal glasses. In case of single vision glasses, the patient has defective near vision only. So, the person using the glasses to read would require taking it off to look at far objects. As this might disturb normal activity, bifocal lenses were developed. As the word suggests, these glasses are a combination of two lenses fused together. For the people who need only near vision adjustment, the upper portion is plain and the lower portion has the corrected lens. This lower portion allows the individual to read, and one can clearly see the distant objects through the upper portion of the lens. Progressive lenses are the recent inventions. They are multifocal lenses that offer a gradual transition between a number of lens parts for different viewing distances. The advantage of these lenses over the bifocal lenses is that there are no distinguishing lines between them. The contact lenses are so called because they are placed on the eye in contact with it, or an alternative to glasses. It is more directed for those who feel stigmatized by the necessity to wear glasses. These are more expensive and require much more care in dealing them. Another option for treating presbyopia is monovision, that is, adjusting one eye for distant vision and the other eye for reading. The effects of presbyopia continue to change because of the rigidity of the crystalline lens continues to increase. Hence, periodic checkup are essential to keep track of changes. Just as benefits and setbacks exist with non-surgical presbyopic correction, surgical techniques are far from perfect but are effective. Current successful techniques include multifocal and accommodating intraocular lenses, as well as monovision induced by monofocal intraocular lenses, or corneal refractive surgeries like corneal inlays and presby of your eye's ability to focus on nearby objects. It is a natural, often annoying part of aging. Presbyopia usually becomes noticeable in your early to mid-40s and continues to worsen until around age 65. You may become aware of presbyopia when you start holding books and newspapers at arm's length to be able to read them. A basic eye exam can confirm presbyopia. You can correct the condition with the eyeglasses or contact lenses. Thank you.